What is jaundice? Simply put, jaundice is when your skin, the whites of your eyes, turn yellow. But what exactly causes that yellow color? Your body is constantly recycling old red blood cells. When these cells break down, they release a yellow pigment called bilirubin. Think of bilirubin as the exhaust fumes from this recycling process. Normally, your liver acts like a filter, cleaning this bilirubin from your blood and sending it to your gut via bile so that it can be flushed out in your stool. However, if your blood cells break down too quickly, if your liver is damaged, or if your bile ducts get blocked, bilirubin builds up in your blood. This buildup turns your skin and eyes yellow, which is the hallmark of jaundice. Now let's break down the causes. First, there is prehepatic jaundice, what we call too much exhaust. In this situation, your body breaks down red blood cells faster than the liver can handle. This can happen for several reasons. Infections, such as malaria, destroy blood cells at a high rate. Certain genetic conditions like sickle cell anemia or thalassemia make red blood cells more fragile, leading to their rapid breakdown. Next, consider hepatic jaundice, a situation of a clogged filter. Here, the liver itself is damaged and unable to process bilirubin efficiently. Viruses like hepatitis A, B, or C can inflame the liver. Lifestyle factors, such as heavy alcohol use or fatty liver disease, often seen in obesity, also play a role. Overdosing on certain painkillers like acetaminophen, Tylenol, and even genetic conditions like Gilbert's syndrome can impair the liver's filtering function. Finally, there is post-hepatic jaundice, which occurs because of a plumbing blockage. This happens when the bile ducts, the tiny tubes that carry bile to the gut, get blocked. Gallstones can form like pebbles that clog these ducts. Tumors, such as pancreatic cancer or liver tumors, may press on the ducts and cause blockages. For babies, jaundice is common because their livers are still learning to work. Doctors often use special blue lights, a treatment known as phototherapy, to break down bilirubin. Let's talk about the symptoms of jaundice. It's more than just yellow skin. It starts with yellowing that typically begins in the eyes and face, then spreads to the rest of the body. You might notice dark urine as bilirubin leaks into your pee, making it look like strong tea. Meanwhile, your stool may become pale or even chalky because it lacks the normal brown color provided by bilirubin due to blocked ducts. Many people also experience itching as bile salts, stuck in your blood, irritate your skin. And finally, there's often a sense of flu-like fatigue as your body works overtime to fix the problem. It's important to seek medical attention if you notice these symptoms. Now, how can you prevent jaundice? The key is to protect your body's filter, your liver. Adopting liver-friendly habits is essential. Eat a balanced diet that cuts back on fried foods and includes plenty of fruits, vegetables, and whole grains. Stay hydrated because water helps your kidneys flush waste efficiently. And of course, limit alcohol intake. Getting vaccinated against hepatitis A and B is also a wise move, as is practicing safe habits. Avoid sharing needles or razors and use protection during sex to prevent transmission of hepatitis B/C. Let's debunk some myths along the way. First, jaundice is not contagious, unless it's caused by infections like hepatitis, which can spread through blood or bodily fluids. Second, while UV light from sunbathing can help treat jaundice in babies through phototherapy, adults need proper medical care. It's not a cure-all. And finally, be cautious with herbal remedies. Although some claim to help, certain herbs like kava can actually harm the liver further. Always check with a doctor first. Jaundice is your body's way of saying, hey, something's wrong. While it might be frightening to see your skin and eyes turn yellow, remember that most causes are treatable if you act early. Whether it's a blocked bile duct, a virus, or a stressed liver, always see a doctor to get to the root of the issue. Your body's check engine light is on. Don't ignore it.